So first of all, hi everyone, and welcome to today's webinar on application of telemedicine in women's healthcare. So Medley is very delighted and honored to have Dr. Runa Acharya as a speaker. So coming to Dr. Runa Acharya, she's currently a gynecologist at Medicover Fertility Center, and Dr. Runa Acharya is an alumni of Mysore Medical College, and she has also done the PG from PGI Chandigarh. And Dr. Runa Acharya brings with her 25 years of experience. And thank you, Dr. Runa Acharya, for taking out time and sharing the knowledge to our viewers.
Thank you so much for the kind introduction.
So let me introduce the moderator. Is Mr. Rahul Paith. Rahul Paith is an ex-CEO and he's founding director of DocOnline. And I request Rahul Paith to take it from here.
Thanks, Sharath. Thanks, Doctor. Thanks for joining this session. And just to set up the tone for the discussion, Medley Med, what I am aware of is like in the market like for last 6 years, and it's a company which builds different kind of platforms for telemedicine service provider. So this discussion is primarily in and around like how technology can help in female care or fertility care, and how it can help today's women and the female population of the country to reap benefits of medical services through technology. So to start the discussion, Dr. Runa, like the first question that comes to my mind is that, the majority of the users today who are using app or teleconsultation or who are having access are the young female or young ladies. And among the young ladies today, the major problem which most of the girls complain is PCOS. So probably, as we are aware that 20 years back in the country, the percentage of ladies suffering from PCOS was not that high. Today, the number has grown up or gone up exponentially high. And so if there is a young lady who is just 17, 18 years old, or maybe 23-year-old lady, and she's having this kind of problem, so how through a remote consultation without meeting a doctor in person, she can get some help from the doctor and also can take care of herself or get some basic support. So what are your thoughts with the kind of people you are seeing today and the patients that you are treating? So how you think that this kind of technology, even remotely, just a consultation with a doctor, can help them to identify if they have PCOS, or can help them to control it in a better way?
Thank you, Rahul, for the question. And I think it's a very aptly asked question for today's generation, because as you said, yes, when I started my practice way back, I am a fertility specialist, so I'm a specialist of reproductive medicine and surgery. That's a specialization after gynecology. And I still remember that when around 15 years back, when I started my fertility practice, PCO was maybe 20% contributed to the infertility population. And now we would say that it has gone up to 40-50%. So, and this PCO is basically a syndrome, a metabolic syndrome. It's a spectra of many diseases together, which the baseline of the base reason for all of them, that is this metabolic syndrome, is one and only, insulin resistance. And this starts way from the time the girl attains her premenarchal age, maybe the early 11th or the 12th year, and her teens. And that's when this disorder starts penetrating or starts establishing itself to cause up a full-blown metabolic syndrome. And this is one of the very commonest lifestyle disorders. So majority of the time, it's only the counseling, the very little medicines we give, but basically the entire focus is on lifestyle modification, diet, exercises. So these things, definitely my majority of patients are fertility related, but I think still around 20-30% of them, I do see them on online basis. So how it works is for maybe if you say a 23-year-old girl comes to me with a basic some symptoms of say irregular cycles or weight gain or say hair growth or whatever the features of PCO may be, we basically counsel them or focus on the lifestyle. So this can be done online. We can there are a lot of apps which come up We myself have so many platforms where we give online consultations. Then we advise them what can be done. It's like just sitting across the patient and discussing in your own room. And it definitely doesn't look very different from how it is a one-to-one conversation. And it's far better than a telephonic conversation or phone call talk. So online, for such cases like where we talk about lifestyle, where maybe if some investigations are needed or scans are needed, the patient can get it done, and then they can upload the reports. We do see the reports. All the reports come in one stack or in one place. So it's sometimes better. It is very well disciplined way of consulting, and all how we have records in the hospital in a what you call in on the papers or as a hard copy. So this stays as a soft copy in their folder or in their name, and whenever we want, we can go back, we can see, and so it becomes very easy to consult the patient online for certain problems. For certain, they have to come to visit us, where we need to do some particular scans or fertility treatments or some injectable drugs and all that. So apart from that, I think a category like PCO, definitely online is a first. I think she can seek a doctor. Sometimes it's just very difficult to come out of their own working place with the timings involved, coming out, taking up a consultation, and never know how much time a doctor would be stuck in the consultation. For the consultation, she may be stuck in the emergency. So if there is online consultation, they can as well keep on doing their work and have a consultation with us whenever in between when we are free. And so it works easier for them too. It saves their time from coming, meeting us, and it's going to be the same discussion what we would discuss across the table.
Right. But coming back to this point, like definitely I understand it helps the patient a lot. But like if someone has already identified that she's having PCOS and the physical consultation probably is done once on the scans and everything is done, do you think the patient also needs constant guidance from the doctor to maintain her lifestyle and other things? And you think that way technology might help? Because then
that's what I'm saying. The basic part of PCO is counseling. So once we establish it's just the medicine away, So for women who are not planning fertility treatment and only going to have cycle regularization or trying to understand where their symptoms have become better or becoming worse. So I think this condition, yes, majority of the things, it's basically lifestyle counseling. What we would ask them is, how is your weight? How are things going? How are your cycles? And these all can be tackled through a virtual consultation also. So it definitely helps this online or whatever the way of virtual consulting a patient or consulting a doctor for them definitely helps in certain conditions, especially the PCO. And it's one way going to help as in the other way when you look at she may think of taking a consultation today and she may end up having a meeting after 10 days. So online, at least she thinks today she'll try to make it up at least today or tomorrow. So,
Right.
So that would be, I think, the greatest advantage, that they'll seek our help or our counseling or whatever the treatment on time.
Right. Sure. So coming back to my next question related to this, and this is for a different segment of people and for a different disease state. So we all know, like in breast cancer is one area which is like ranked number one among Indian female in terms of among all the cancers. And I was reading some data which was saying almost like 25 to 50, 30 people or 30 ladies are having breast cancer possibilities in out of 1 lakh, and the mortality is also pretty high, to 12 to 15 in 1 lakh. So in such a case, like if I have to ask you a question from a different context, like we have seen that different governments and also private players have established this mohalla clinic or something like that, or PHCs which are powered with telemedicine in rural areas or in different areas. Now this is for population which is not having easy access. This is not for the city population, the question that I'm trying to ask. city population, people can easily go for a scan after the consultation and they can do. But for a rural population, which is like having the best luxury is to consult with the doctor online. And that's the only thing she can do. In that case, like how can we help, or how the doctors can help such patients to identify if they have a breast cancer, or can teach them certain things that they can, identify on their own if there is a lump or something. So do you think there is a possibility, or what kind of help can be provided for the rural population in this case?
I remember around maybe 20 years back, it was posted in one of the very rural areas where
Right.
the concept, usually what happens with this telemedicine, I've seen it in 1999 or 2000. And
Right.
that's when we had one of the very good SVYM camp place in a very tribal area, which had a telemedicine facility, in those days. So what would happen was that we as a, I would not say it was a PH, it would have been a bit, it was like a, sort of a charity or mission hospital, which was set in that area. And one of the doctors posted there. So the doctor who's posted there, who is usually an MBBS or something who understands, maybe an RMP, you can say. So these are the people who connect between those people, because they cannot even understand what is telemedicine, to be very frank. So they have some in middle person. It could be a doctor who's an MBBS, or maybe a trained health worker, nurse, somebody like that, or A&M, or some paramedic staff. So these people will be put on the reports to the specialists across in the cities, and that's where they read. So what could be done is that these specialists, through the help of these para or whoever is helping out in the tribal area or the rural area, could teach them what is self-breast examination. Because that's a very important thing which we promote to all the women across, be it urban, be it rural. So it doesn't mean that if woman is in city, she will come to the doctor for every small single checkup. So for all of them, we say that yes, self-breast examination. So there is a way the self-breast examination, what is SBE, is taught to the patients. So when we try to teach them in the telemedicine, there is some person sitting there who does explain. Now I'm talking about only the rural population. For people who don't understand what would be a lump. So, these self-breast examination will be taught to them so that they understand and they examine. And if they find there is a problem, so they can get the basic testing done, like maybe they may not have a sonomammography or MRI there, but they may have a routine. Usually these hospitals or the charity hospitals where telemedicine facilities are there, they definitely have ultrasonography and X-rays. We did have. So they can get an X-ray done, or they can get a mammography, sonomammography done, and send it across to the senior doctors or the senior doctors or specialists sitting in the cities. So this is how telemedicine can work for this woman. First of all, first for making awareness what would be self-breast examination, to understand and get back to their peripheral hospital if they find something is abnormal, get the investigations done there, put across the investigations to the people sitting in the other end, and then at least understand what is it really dangerous, and if so, then shift them to a higher level, and if not, reassure. So this could be the way we can look at, from with the help of telemedicine, reaching out to people in the rural or the tribal areas. So I think majority of the things can be sorted if a proper self-breast examination is taught to the patient. As you said, the mortality rates now, I would say, rather has been too low with breast cancers, because we have seen very bad breast cancers earlier, but now because of the self-breast examination, routine checkup, maybe I'm more in the rural, urban, so we don't see it so advanced like big cancer mass, So we see them as small lumps, and we see them at a very early stage. And hence, the chances of mortality, if diagnosed at a very stage 1, the survival is very good. So, it's almost more than 95%, 99%. So, we talk about 5-year survival. The survival is too good if they're diagnosed in a very early stage. And we don't go for radical surgeries, We go for conservative surgeries. Imagine in a breast cancer, which was so deadly. So nowadays we talk about doing conservation surgeries. And this is one of the, I think, best part of awareness, education, early diagnosis, and the newer technologies, so putting all together, I think this at least 50% should penetrate to the rural population.
Sure, absolutely. Thanks, doctor. That was quite insightful. Now, coming back to my last question for this session today, and that is like for the majority of the population where a lot of health apps and everything has come up today for pregnant women. So, pregnant women cases are cases like where they have the maximum anxiety, they have hundreds of questions, and nowadays, since like the first time ladies who are getting pregnant, they have higher number of questions and anxiety and queries, and for that every query they want the answer from the doctor, because there is a lot of information that they are getting on the web. There are a lot of apps which are feeding them with information, but still a stage comes when the new parents or would be parents are more they trust the doctor always, like if any issue happens, and they want to get access to doctors any point of time, which actually becomes very difficult both for the patient and the doctor, because physically it is not possible, even if the patient is going to a hospital and for every small thing speaking to the doctor. And so how you think that technology has played a role, and now since this COVID time has gone recently, and I'm hoping that it is gone, so in last 2 years you might have seen like a lot of pregnant ladies, how your experience was with them, and how you use technology to communicate with this would be mothers or pregnant ladies.
Yeah, I think COVID uh, put across a lot of insight about the technology which was there earlier, but not utilized to the fullest, and it definitely made us understand that many things can be sorted. Not meeting, you can sort things out, not even consulting directly. Majority of the times, what actually in the beginning of the COVID was basically the online portals, whatever WhatsApp or whatever, where we would see the reports, we would reply the reports, we would say don't come. So because of the COVID, the restriction came on personal coming and consulting. People were scared to come to hospitals, and we were also not interested to call people whom we don't need to really see. So just reports dikhana hai, mat aao, just send them the reports across. And then slowly we started getting into online consultations. So we started keeping few hours of the day or few consultations per day online. Now how it started working, there are 2-3 things which I would like to clarify with you. Is one is that, yeah, there are many queries. Anxiety was far more in COVID, during COVID in pregnancies. What will happen? So what we could do is we started giving small clips. So how it started working with me is, many of the company or many of the portals started visiting me, or websites, and they started taking out small clips, maybe through online. So we have some 50 questions put across. Now all the 50 women may have 25 questions in common. So it became very easy that these questions are answered online, and they're put across on either on the Insta or on the Facebook lives, and this is being circulated. So I think 50% or more than that questions were answered just hearing to what we are talking. So so this became one of the modalities of treatment, is that just make a clip, record things which is like, what are the diet you need to follow up in COVID, or what are the things you should be worried in COVID, with pregnancy going on. Are you planning your pregnancy in COVID? What are the precautions you take, and what is the impact of COVID on your baby? So these were very common questions. I would say 150 questions. If you take these questions, were answered by the specialists and put across in FB Live, Insta, or so many blogs. So this was one thing which helped. The technology helped us. The second thing was, make a questionnaire, and we can put them in our web pages, where what to do, what not to do. And the third thing was that many of them need not come to us. So we would say, okay, go get a scan done. So see, pregnancy in the initial period is only consultation. We may not check because there's nothing seen. So what happened was that we would tell them to get scans done. and we know that the baby is doing fine. So, just have a consultation. So first half of the pregnancy, I think, could work with online, or keeping them at home in their own area, safe, COVID-free areas. And even the COVID patients who are COVID positive also could seek consultation. Either they don't want to come to us because of the COVID fear, or because they are COVID positive, we don't want them to come to our hospital. But then so many things could work. Just keeping them at home, getting things done what was required in the nearby. There were people who would come home for blood tests, for everything, and that's how I think we could refrain them from coming out, and the reports were put across. So this is the way I think we could manage in COVID, and I think this opened up our eyes that in a OPD of say 20, 50 or 60 per day, I can still reduce 10 people from not coming to me. And I think I can keep this going in spite of COVID being there or not. So I can tell them don't come. And it becomes, it became easy for people who are staying outstations. We were IVF specialists. So people would become pregnant. They can't travel. It's not easy. So we would say, in your own place, get these things done, send it across to us. So the first 3 or 4 months of pregnancy can be managed online. They can check their own weight, BP, they can get the blood test. But after that, I think they need to personally visit the doctors, whatever it be, COVID, non-COVID.
Sure. And one final question, like a lot of my new doctor friends who have asked it, and they have this normal question. So I thought just to get your experience as a doctor, like how technology has helped to increase your reach among the patient, and what was your experience? Because now with technology, we are seeing that we sitting in Bangalore can speak with a doctor in Delhi, or in any tier 2 cities, we can speak. But from a doctor's perspective, like do you really feel that technology has helped to increase your patient base across regions or across country?
Yes, across countries. I have a lot of patients who have my consultations at 7 o'clock online for only the US clients. So I think it's actually doing a good job. It was there before. I'm quite into technology from the very beginning. Because before COVID also, I used to have online consultations. But yes, I didn't have the portals, because the numbers used to be too less, So we used to do in WhatsApp video call, and then, but now I have a portal where I type a printed report, and it goes a printed report, and actually it looks very professional. Exactly, it goes as a proper review. Everything comes in that, and I do it for my not only in India. I have a lot of people across the globe who take online. And now being an IVF specialist, how it helps is IVF is say 2-month program, and the patient couple has to be in India for minimum 1.5 to 2 months, ideally 3 to 4 months. But that extra 2 months I cut short because of the online consultation. So they are staying in the US, they get their base done. I write prescription, they get those medicines either in the US or from India, and they come directly, at the time. I know them for 2-3 months. I prepare them well, and they directly come on the day I have to start the injections. In 10-15 days, the IVF protocol is over, and they can as well fly back the next month. And so many times we have patients, we just call them for that particular duration for embryo transfers or for IVF, and majority of the treatment is done where they are. So, and that has actually helped us a lot. I would say, yeah, it's science and technology both go together. And with so many things, we have our entire artificial intelligence coming into picture. We have a lot of things which help. We have our systems, our softwares, all our, IVF lab, we have we have artificial intelligence in our embryology labs. It's very advanced. I think advanced technology and advances in the science also. It's actually both of them grow and go together. So it's very important for us to stay at par with what's going on in the world, and utilize each other's help, and grow. Both of us grow.
Sure. I think that's all for today. And thank you, doctor. Thanks for sharing your wonderful experience. I'm sure like once Medley team shares this video across, the people who are listening to it or watching it, they will learn a lot, and they will get the confidence from your experience, what you have shared and what you have experienced, and not only during COVID, but in terms of also how your reach has increased because of technology, and how a lot of cases can be resolved. So it was a wonderful discussion. Thanks a lot, doctor. And yeah, over to Sharath.
So first of all, thank you, Dr. Runa Acharya, for joining this webinar and sharing great insights on women's healthcare. I'm sure all our attendees has gained a lot of insights from this particular webinar. Thank you to all the attendees, and thank you everyone.
Thank you. Thank you so much.